Welcome back. Some cautiously optimistic news for Ontario, where COVID-19 infection rates may have plateaued across the province. That indication is coming from sewage testing. Let's take a look at this graph. It shows a spike of COVID in wastewater in December and a drop-off in the numbers by early January. But researchers are warning that they're still detecting high levels of Omicron. Even before an infected person shows COVID symptoms, they shed bits of the virus in their feces, and that genetic material can then be detected and monitored in wastewater. Let's bring in Andrea Kirkwood. She's one of the researchers on this wastewater surveillance project. She's also a professor of biological science at Ontario Tech University, and she's in Whitby, Ontario tonight. Hi, thanks so much for being with us.
Thank you for having me.
So help us understand a little bit, because we know that there's been kind of a lack of reliable data because of PCR testing being overwhelmed. So this is another way that the province has been, kind of getting information about COVID in the environment.
Oh, absolutely. I would say if we backtrack to near the beginning of the pandemic, when there was a lot of concern about how we're going to be tracking the prevalence of COVID in our communities. And so wastewater-based epidemiology is a technique that has been known for a long time, for probably a decade or two. But it was really the pandemic that thrust this research into kind of, the higher echelons of like global interest. And so in Canada, it started with the Canadian Water Network, getting a coalition of researchers from across Canada to try and develop techniques and ways and strategies to look at wastewater to monitor for COVID-19. And so in Ontario, the province actually invested really early on to help a number of universities develop techniques, and our partners with the public health units across Ontario. We were in a really good position that when the Omicron wave came to Ontario and testing was overwhelmed, clinical PCR testing, they were able to pivot to the wastewater data that by this point had really high, quality control, quality assurance, reliable data that now you can see that the Ontario Science Table has modeled it, and it's been giving us some, reliable information about where we are in the Omicron wave.
Right. So this wastewater data is actually informing and impacting public health decisions?
Yes, I would say that over the last year, public health practitioners at first were a little bit, uncertain of how to use wastewater data, but now they see the value. And of course, when you lose one of the tools or a few of the tools in your toolbox, being able to turn to another valuable tool that can give us actually early warnings of disease prevalence, such as hospitalizations. And so now we're actually seeing the fruits of our labor over the last year. The data is really coming to play and being used.
So we heard some good news there about infection rates maybe plateauing in Ontario, but we're also seeing how prevalent Omicron is. What more can you tell us about that?
Yeah, well, just to give you a little sense, we in our lab at Ontario Tech University, we've been monitoring 11 sewage treatment sites across Durham Region and Simcoe, Muskoka. And when we're measuring and monitoring for Delta, it was relatively low but it was detectable. But it was so dramatic when the Omicron wave started. And I think it's just the nature of this particular variant. It's very different. It really spiked over the Christmas holidays into the new year. And then I think in response to the public health measures that were instated early in January, you see a response. And even Dr. Peter Uni, he thinks that the deceleration we're seeing now in the wave is likely in response to public health measures. We still are a little bit cautiously optimistic, but now that schools have opened up, college and university campuses, they won't have restrictions in capacities and so forth. So it'll be interesting to see the wastewater data in the coming weeks.
So you mentioned that, testing wastewater like this isn't a new concept. It's been around for about 10 years, but COVID had kind of really put it in the spotlight. What do you see as the future as this type of testing now that it's, been proven to be, really meaningful and effective?
Well, it is one of the positives of the pandemic, if you will. We really see great utility in wastewater-based epidemiology now. Now that we have a working relationship with our public health units, with our the public works departments who are collecting the samples for us, we have a very integrated system, not only in Ontario, but we're connected to, the federal, Public Health Agency of Canada is very much interested in this, working with the National Microbiology Laboratory. So I think moving forward, it would be wonderful to develop a network across the country to learn from each other. We're very open with sharing our methods and ideas. And I think that there can be ways to use wastewater monitoring, particularly for rural communities and smaller communities where they may not have the public health system set up for, say, clinical testing. We can do surveillance for, outbreaks of, listeria, other infectious diseases, that sort of thing. It could be very useful.
Maybe detect the next pandemic before it happens. All right.
Yes, exactly.
Professor Andrea Kirkwood, one of the researchers involved in that wastewater COVID-19 surveillance project, a professor of biological science at Ontario University. Thanks so much for sharing this with us.
Thank you.